Before making impression, let us understand the armamentarium required for making impression. Firstly, perforated stock tray of desired size. Addition silicone, putty consistency, it includes base paste and catalyst paste. The manufacturer also provides scoops for measuring amount of material to be dispensed. For ease of identification, base and the catalyst paste are color coded. Cartridge containing addition silicone in light body consistency. Similar to putty, it also comes in base and catalyst form. For dispensing light body, remove the lid. Attach mixing tip to the cartridge along with the intraoral tip. Now let us understand parts of the gun. This is plunger. To attach plunger to the gun, ensure the knob is pushed upwards. The plunger is pulled backwards as shown. Before placement of cartridge, the plunger should be completely pulled backwards. For placement of cartridge, a notch is provided which should coincide with the elevation. In the end, lock the cartridge by closing the upper lid. Before attaching the tip to the cartridge, dispense a little amount of light body to avoid any sort of contamination. This is universal adhesive. Now, let us understand the procedure for single step impression technique. We will be demonstrating one step impression making for the lower arch. As you can see, lower right first molar has been prepared. Firstly, select appropriate size perforated stock tray, ensuring all the areas of interest are covered. Dispense with the help of scoop equal amounts of base and catalyst. Make sure while handling the putty, the operator should be wearing vinyl or nitrile gloves. If handled with latex gloves, the sulfur within the gloves may retard the setting reaction of the putty. The base and the catalyst are placed on the tray to ensure adequate amount of putty for impression making. Apply a thin uniform layer of universal adhesive in one direction onto the tray. Let it dry for few minutes before loading putty on the tray. For making one-step impression, four-handed dentistry is followed. The assistant will knead the base and catalyst of the putty. While kneading the putty, assistant has to ensure the putty is mixed to uniform color. Once uniform mix is achieved, load it on the tray. Simultaneously, the operator injects light body around the prepared surface of the tooth. While injecting, the operator needs to ensure that the intraoral tip is in constant contact with the tooth. This avoids entrapment of air bubble. The operator now will place the loaded tray in the patient's mouth. After the impression material is set, according to the manufacturer's instruction, retrieve the impression tray with a single snap. After removal, the tray should be thoroughly washed under running water. Furthermore, inspection of the impression is critical and the clinician should ensure the area of interest is properly recorded. The major drawback of this technique is the critical areas are recorded in putty as the putty due to higher viscosity